Hello everyone. We are discussing different aspects of palliative care integrative approach in 12-week certificate course under SWAM portal. And we are coming to the end of this course. And today I am going to talk about the wound care and skin health in palliative care patients, challenges and best practices. Introduction to the skin and wound care. Skin is the body's first line of defense, all of you know. Immobility and chronic illness impairs skin integrity. Early intervention reduces the patient's suffering and complications, right? Skin is the largest body organ, body tissue, and it is a sense organ also. Touch effect is due to skin. And wound, what is wound? Pressure ulcer, this is the bed sore, diabetic foot ulcers, and traumatic wound from fall or friction. These are the common wounds which you find in the skin. These are the, since I have shown you earlier, this is a pressure ulcer. Bed sore is a pressure ulcer, bed sore. What is bed sore? If you are bedridden for a long time, there are some pressure points are created in your body, and those areas are sensitive for wound, and that is why we always say that immobilization in the same position for a long time is a cause of disease, cause of skin bad health. You know, while you are sleeping for 6 to 8 hours, आप करोड़ बदलते रहते हैं रात भर, 20-25 बार करोड़ बदलता है एक आदमी पूरे रात 8 घंटे के सोने में. अगर वो लगातार सोया रहे ड्रंकन की तरह, तो उसका प्रेशर पॉइंट बन जाएगा और स्किन वहां पे फ्रेजाइल हो जाएगी. फिर सुबह एक्टिव होगा तो वो ठीक हो जाएगा. बट दिस इज द वेरी इंपॉर्टेंट पॉइंट टू नोट. प्रेशर creates wound in the skin, and you may not find it physically, but biochemically and histologically there is a wound. The body repairs it in the next day, and if you are failed to activate the skin area, then there will be permanent wound, and that is called the bed sore. So this slide is showing you what are the, if you are sleeping flat on your bed, what are the pressure points. You see, head, shoulder, knee, your buttock, your ankle, your knee joint. These are the special points. So pressure ulcer, venous ulcer, diabetic foot ulcer, peripheral arterial ulcer, infectious wound, surgical wound, and radiation wound. There are different kinds of wound. And today I am going to talk about pressure ulcer. All these wounds are hard to heal, difficult to heal. But pressure ulcer is main I am going to talk, because in the palliative care patient, suppose a patient of a stroke, he is paralyzed, or a patient of Alzheimer's, he is not able to move. Most of the time he is dependent on somebody for the day-to-day activity. If the helping hand is not there, he is in the bed. So that kind of things, a chance of, if a patient is in the ICU, he is more chance of getting bed sore. So pathophysiology of wound, you should understand. This is a blood vessel, neutrophils are there, and these are the hair follicles. The hair is coming, and this is the wound formation. Fibrin clot, collagen, and bacteria is entering here. This is a hemostasis. Pathology of wound, you should first know there are 4 types of hemostasis. Means immediate clotting of blood. Inflammation means immune response. Proliferation means new tissue formation. And remodeling means wound closure and scar formation. So elderly have slower healing and fragile skin. What is fragile skin? Skin which is sensitive to pressure, which is the blood supply is poor, so the tissue repair is also poor. So you know, skin is a living tissue. It always needs a very strong blood supply, and if this is compromised, the tissue will not survive. It will not be healthy. Hypoxia is a very important part, which should not happen to any organ, but especially to skin, it should not happen at all. So this is the picture is showing the hemostasis is a, this is the condition, and the inflammation and remodeling and proliferation. So bed sore, the pressure ulcer, I am focusing on this today. The cause and management aspect. What is the definition? Localized injury to skin and underlying tissue, usually over a bony prominence. Bone is there. Suppose if the elbow joint is there, the elbow is the bone and it is prominently here. And if you are put a pressure on this area, there is a chance of wound due to prolonged pressure, often in a bedridden or immobilized patient. Immobilized means a patient in the ICU like that condition, or in the stroke. Common sites: sacrum, heel, hip, back of the head, shoulder, elbow, and ankle. I have shown you in the first slide. These are the locations of the body. Main cause: pressure. Continuous pressure reduces the blood flow to the skin shear. The skin slides against the surface, bed sheet, which create a friction, and the repeated rubbing causes the skin breakdown. Then the moisture from sweat, urine, or stool increases skin vulnerability. Poor nutrition and hydration impair healing and tissue strength. Inactivity, immobility due to stroke, paralysis, and terminal illness. So these are the important factors which I want to tell you. The one is the pressure, one is the shear, third is the friction, fourth is the moisture, continuous moisture, fifth is the poor nutrition and hydration, sixth is the inactivity. There are 6 conditions, 6 causes which are responsible for pressure ulcer or bed sore. Pressure ulcer overview: cause, pressure, friction, and moisture. I have shown you in the previous slide. Common sites: sacrum, heel, and elbow. You can see these wounds. This is ankle. How it happens there. Early signs: redness. This is redness, warmth, and tenderness. This is the condition when you will find progression of the ulcer. Pressure ulcer stages you can see here in this slide. Stage 1, stage 2, 3, and 4. What is this? This is the epidermis, skin layer I am telling you. This is the dermis. This is the hypodermis. This is the muscle, and this is the bone. So this is the skin structure. What happens? First stage is the epidermis. Red, non-balancing skin. This is the red, non-balancing skin. Stage 2, it enters to the dermis. Blister and shallow open sore. Now some blister and open sore will be created. You see, this layer is intact. This layer has broken. Epidermis has broken now. A opening is trying to be created. Stage 3, wound extends into the fat layer. Hypodermis, stage 3. This is a fat layer. The wound is extending below from epidermis to dermis and dermis to hypodermis. And stage 4, exposed muscle, bone, or tendon. It has reached to the muscle and bone up to this stage. So this is the stages of ulcer formation under pressure ulcer. Management of the bed sore, very important. Preventive care, allopathic management, and Ayurvedic management. I am discussing all the 3 because this course is an integrative approach of palliative care. So we are discussing the allopathy as well as the Ayurvedic approaches. First of all, what is the preventive care? Frequent repositioning. Every 2 hours, use pressure relief. If you are taking करवट बदल रहे हैं हर 2 घंटे पे, मतलब this is the maximum time. If you are less than this is good. तो pressure relieving हो जाएगा. Pressure will be relieved there will be no continuous pressure on that point, which is very important to prevent the pressure wound. Mattresses and cushions keep skin clean and dry. Monitor high-risk area daily adequately. If a patient is bedridden, the mattress and the cushions should be kept dry and clean. And the hydration and protein-rich diet should be given. And lastly, educate the caregiver on skin care. The caregiver should be made alert to observe every day the pressure points of the patient, whether is there any redness, like this thing is coming up or this thing is coming up, what is the stage? This is the prevention. It should not happen even this. Then it's called the prevention, preventive care. If it happens, then what to be done? Topical antibiotics, mucopyroxine, silver sulfadiazine, debridement, removal of dead tissue, dressing, hydrocolloidal foam, alginate, systemic antibiotic for infected ulcer, and pain relief. If there is pain in the wound, then the pain relief should be taken. Management should be done. So this is very important. The topical antibiotic, so that any infection, if it is there, it should be controlled, and proper dressing should be done. The wound should not be left open, and pain relief should be managed. The patient should be comfortable. Dignity and comfort of patient is your goal. Main goal of the palliative care is comfortable, dignified life of the patient. So this thing is very important. Ayurvedic treatment, topical paste of neem, turmeric, madhuestri are effective, and washing with triphala, not a neem decoction, oral support with guduchi, manjistha and guglu for healing and detoxification, and use of jatyadi tel or nalpadami oil for wound dressing in chronic cases. And these are the topical addresses for the wound. Either the topical paste or topical oil or something is given. But there is another approach of the treatment, that is the virachan. Medicated laxative is also very effective, and Rakta Moksha, leech therapy under the expert care. These are the Panchakarma methods. There are the 5 methods of Panchakarma, that is the Vaman, Virachan, Nasya, Rakta Moksha and Basti. So Virachan and Rakta Moksha are 2 important karmas among the 5 Panchakarmas, which can be effective in management of bed sore. One thing more important, bed sore is one thing. There is a localized wound that is called the bed sore. But side by, there is a pre-bed sore skin care. But suppose you have got a wound. The wound is there. We are taking care, the wound should heal. But side of the wound, that area is also become fragile. If that is not strong, the wound healing will be compromised. So if you want to have good wound healing, then the nearby area, that is called the pre-wound, pre-bed sore area, that should be healthy. That should also be taken care. So for that, what you have to do, this is I'm going to talk about. The relevance of Pitta and Rakta Dushti. This is the Ayurvedic term. In many early skin changes, Pitta and Rakta vitiation leads to burning sensation, inflammation, and dusky skin, which Virachan targets. The Virachan helps in lowering down the burning sensation, lowering down the inflammation, and lowering down the dusky skin coloration. This is important. Effect of metabolism. Virachan improves liver function. And you know, liver is the master gland. Many things are produced in the liver. Albumin is produced, and many digestive enzymes are produced. So whatever I have earlier showed you, that the rich protein diet should be given to such patients. But the protein will be not digested if liver function is compromised. So liver function should be taken care. That's why in Ayurveda it is said, Agni Chikitsa iti Kaya Chikitsa. Means digestive system, if it is correct, most of the diseases of the body will be automatically controlled. This is very important. Isliye everywhere we are talking one symptom, but ultimately we are coming down to the digestive system. Why? Because digestive system is responsible for nutrition, and nutrition is the basis for any disease treatment. That's why we say the Virachan improves liver function, skin metabolism, and microcirculation. Microcirculation in the skin metabolism. Skin is a living tissue, so all these epidermis, dermis, hypodermis, all these layers, cells are there. That should be properly under metabolism. And microcirculation, blood circulation should be intact. And many may reduce internal toxins. And Virachan removes the internal toxins. What is the toxin? Unmetabolized products accumulated in the cell, which is a burden to the cell. That has to be removed. How it is removed? It is removed by activating the autophagy. Autophagy is responsible by the action of lysosome. The cell organ, lysosome. So lysosome should be active. It should properly perform its function. And when it will perform its function, it will digest the unused proteins or peptides which is present in the cell, which is a burden to the cell, non-functional thing. So that has to be removed. So this is called the detoxification process. So detoxification of the skin cell can be attained by Virachan improvement. And then supportive herbal botanical extract used with herbal like Triphala, Kutki, aloe vera, and Avipatta churn. These are the herbal products which are used for maintaining the Pitta and Rakt Dushti by Virachan and by improving the digestive system. Both things are interlinked to each other. And conclusion, Virachan may be effective in preventing in person prone to bed sore, particularly in Pitta predominant constitution, but must be personalized. It is very important to note that in the human being are classified into different prakriti, genetic constitutions. Vata, Pitta and Kapha is the main, but overlapping are there. There are total 7 constitutions. But broadly we say there are 3 constitutions, Vata, Pitta and Kapha. If a Pitta predominant person is there, then he should be particularly treated with Virachan. Because Virachan, Pitta is already high in that person. And in this bed sore condition, Pitta becomes more high. So that has to be controlled by doing it. So Virachan helps detoxifying Pitta, improves skin resilience and blood flow. What is the main function of Virachan? Helps to detoxify Pitta, improve skin resilience and blood flow. This is the take-home message. Now, the bed sore pressure ulcer can begin to develop as little 2 to 6 hours. I told you, if you are sleeping for 8 hours without taking karvat, you are likely to have some problem with your skin where the pressure is there. In the bedridden or the immobilized patient, if there is a constant pressure over the bony area, constant pressure, the skin is exposed to moisture, shear or friction, and the patient has a poor nutrition, dehydration and reduced circulation. If these are the conditions, there is a chance of bed sore formation if the pressure continues from 2 to 6 hours without change of the position. What are the risk factor level? High risk, moderate risk and low risk. What are the high risk? ICU patients, frail. The patient has fallen down. The old age people, the frail is very, very common. People fall, they get fractured and then they are on the bed. And elderly and spinal injury. Spinal injury is like a paralysis. There is no movement. You are always in the bed. So elderly, spinal injury, frail and ICU. These are the high risk patients for bed sore formation. Moderate, immobile with partial care. Immobility, the high immobility is there, and care is also not good. And low, good care and mobility support. If you are a good care of your skin and you are mobilized, your body is mobilized, then there is low risk of bed sore formation. This is time I have estimated time for the bed sore 2 to 4 hours in this kind of patients. 2 to 4 hours. Moderate in these patients, 6 to 12 hours. But in a good quality of life, rare or more than 12 hours, if you are on the same pressure point, there is no problem. So even short duration of unrelieved pressure can damage the skin in high risk patients like this high risk patient. The damage may not be visible immediately, but progression beneath the skin starts. It may sound surprising, but it is true that even sleeping in same position for more than 6 to 8 hours without movement can initiate a pressure ulcer, particularly in elderly or frail individuals. Patients with paralysis, reduced sensation, or unconsciousness, those with poor circulation, dehydration, and malnutrition. These patients are more prone for bed sore even in 6 to 8 hours of sleep. It happens because, why it happens? Skin and underlying tissue require regular blood flow or oxygen and nutrients. Regular blood flow can only be ascertained when there is a no pressure point. If pressure is there, blood flow is interrupted. If blood flow is interrupted, then oxygen hypoxia will be there, nutrition depletion will be there. When compressed, especially over the bony area, the blood supply is cut off. This is the main cause for initiation of bed sore. If pressure is unrevealed for several hours, it starts damaging the tissue, initially underneath the skin and often not visible at first stage. Tissue damage has taken place, but it is not visible externally. This is important. So prevention measures are: don't allow pressure to be persist more than 4 to 6 hours in one position. Keep on changing the position. However, for a healthy adult who changes position naturally during sleep, the risk is very low. Most people shift subconsciously 20 to 30 times per night. This is also surprising to me. I was not knowing, but I read it. 20 to 30 times in one night, preventing this. But in patients who are heavily sedated, under palliative care, post-surgery, or under coma, they are having natural shifting does not happen, and that is why the 2 to 6 hour risk window becomes real. In this kind of patient, it is become true. Now, bed sore prevention and early detection checklist. A palliative caregiver, as all of you are getting this training, so you must know how you should check, tick yes or no. Positioning, what is the positioning status? What is the skin inspection status? What is the hygiene and moisture? What is the nutrition and hydration of the patient? What is the support surface? And alert signs. There are the 6 parameters you have to see every day. Reposition patient every 2 hours, whether you are doing or not, or every 15 to 30 minutes. Wheelchair people. If a bed, 2 hours. If it's wheelchair, 15 to 30 minutes. Use pillow or foam wedge to offload pressure on heel, hip, and tailbone. Keep head of the bed below 30 degree to reduce shear. Okay? If you are doing, put yes. If you are not doing, no. Skin inspection. Check bony area daily. Sacrum, heel, elbow, shoulder, and hip. Look for redness, warmth, discoloration, hardness, and pain. And note if the skin stays red more than 30 minutes after pressure is removed. If yes, it is problematic. If no, then it's fine. Hygiene, moisture. Keep skin clear and dry, especially after urine or stool. Use moisture barrier cream. Barrier cream means zinc oxide. Moisture barrier cream, zinc oxide. In perineal area, avoid friction when cleaning the or turning. Nutrition and hydration. Ensure adequate fluid 1.5 to 2 liters per day unless restricted. In the kidney failure patients, this much water is not allowed. Otherwise, if kidney failure is not there, this much water can be given. Provide high protein meats like egg, dal, paneer, fish. Give vitamins and minerals, especially vitamin C and zinc, to aid in the wound healing. Support surface. Use pressure relieving mattresses or foam pad. Now the special beds are coming for this kind of patient. Use pressure relief mattress or the foam pads and keep bed linen wrinkle free, because the wrinkles is the place where the friction may take place. Encourage brief out of bed time if possible. If it is possible to move the patient out of bed, encourage it. Skin looks purple or black, blisters appear on the skin, an open wound you observe, or foul smell is coming, or drainage is coming. Patient reports burning, numbness and pain. Immediately consult the doctor. Alert means consult the doctor. Now I am talking about dressing. Clean with normal saline. Avoid harsh antiseptics. Dressing should keep the wound moist, protected and clean. Change dressing based on exudate infection sign. Advanced wound care product, foam dressing, absorb drainage, silver dressing, antimicrobial, negative pressure therapy, speeds healing, and skin substitutes for deep or non-healing wound. So these are the traditional wound dressing material. These are the advanced. What are the traditional? Gauzes. Gauzes are used. Transparent films were used. Foams were used. Hydrogels were used. Hydrocolloidals were used. And hydroconductive dressings were used. But now, foam dressing, silver dressing, negative pressure therapy, and skin substitutes are being practiced. Managing hole. Up to now, I have talked about the bed sore, but there is a holes and devices in the skin. This is a stoma, and the next class I am going to talk in detail. But here I am just introducing. Feeding tubes keep stoma site clean and dry. Stoma means a hole in the body, either to give nutrition or to take the excreta out. If there is intestinal blockage, then you have to make a hole so that the intestine excreta should come out. It is not passing to your anal route, then we make a stoma. So this is also very fragile area where there is chance of infection. So we have to be very careful in managing this kind of wound. So urinary catheter, tracheostomosis, use sterile techniques for cleaning. So this I will take in the next class. So device complications, skin breakdown around insertion point, infection, local or systemic, sepsis, mechanical issues, tube blockage or dislodge, e-skin component, integrated circuit, biosignal sensing and medical applications. These are the equipments I am showing you: photo detector, sensory devices, healthcare equipment like your watch, and therapeutic applications. So this is the flow chart, how the devices are used, and if the devices you are using, they can also cause a complication. You are using these devices, but all the time you are using a watch, you are putting a pressure on your skin. That is not correct. 24 hours equipment on your skin may cause problem. Sensing device array using regularly, so this may create a problem. Skin adhesive devices, they also creates a problem. PPG sensors. So skin allergy and rashes. Diaper rashes. Diaper are used for those people for inconsistent urination, for the children, for the elderly people, that create rashes caused by incontinence. Drug reactions, rash, itching and redness. Drug reactions also cause rashes, skin allergy, okay? Fungal rashes, often in moist, warm skin folds. You can see these are the places where the rashes can appear, maybe because of the diaper rashes, drug reactions or fungal reactions. Fungal and bacterial infection, red, itchy rash in fold. Cellulitis, painful, swollen, red area. And MRSA needs isolation and specialized care. So these are the method how you can measure the wound size. The chronic disease impact wound. The chronic disease also there is chance of skin wound. Diabetes mainly, poor blood flow, slow healing. Peripheral artery disease, impaired circulation. Malnutrition, weak skin and immune system. So these are the conditions: malnutrition, peripheral artery disease and diabetes. These are the metabolic diseases which are making your skin more prone for skin wound. So prevention of skin breakdown. These are the A. Changing the position. You see, the patient is in the ICU or in the bed, hospitalized. Keep on changing position. You see, a regular change. Mobile plate. You can use the mobile plate for changing the position. Here, you see, they are using like this. They are removing it, again using it like this. So reposition the patient every 2 hours by using the mobile plates. Use pressure relieving mattresses. Maintain skin hygiene and moisturization. Manage inconsistency and moisture. Nutrition is very important. I have told you that nutrition is very important, but eating is one thing, and is proper metabolism by proper digestive system and proper liver function is another important point. But the malnutrition should not be there. Malabsorption and malnutrition, two things are different. If you are not giving enough protein, this is a malnutrition. And if you are giving the enough protein but it is not being properly absorbed in the body, this is called the malabsorption. So both has to be taken care. Nutrition in wound healing. Protein, crucial for tissue repair. Vitamin A, C, E support the collagen and immunity. Zinc promotes healing. And hydration keeps the skin supple and intact. So these are the 4 important factors which is I picturize here. This all are the milk product, and this is the all meat product, non-veg product, and these are the beans and the nuts, the vegetarian product. But here I tell you that the Ayurveda has an important edge on the nutrition. I am coming to the next slide. Nutrition and natural support for healing. Why it is antioxidant rich food like berries and leafy greens, omega-3 like reduces inflammation, healing food like turmeric milk, bone broth, and supplements like vitamin C, zinc, protein shakes, etc. Effective Ayurvedic Rasayana, this is what I wanted to emphasize. Ayurvedic Rasayana group of drugs are very important food supplement along with the nutrition supplements of Ayurvedic Rasayana, if added, can be 1 + 1 11 situation in the pre-bed sore skin care. When are these useful? Stage 1 bed sore, red, non-balancing skin but unbroken. If as long as it is unbroken skin is there, then these rasayanas are very effective. Preventive plus early reversal. Early reversal also, it is important for fragile or dry skin under pressure to restore the integrity as part of the daily skin care for immobile patients to maintain the microcirculation. So this is the complicated slide. I will take some time. The rasayana for skin care, internal and external application. Amalki, Amla, Haridra, turmeric, Manjistha, Rubia cardifolia. These are the important drugs of Ayurveda. Guduchi, Tinospora cardifolia, Maestri Yadugha, licorice, neem, Satavari, Asparagus racemosus, Ashwagandha, Withenia somnifera, Trifla is a compound of Harar, Behela and Aula, and Kukumadi Tailam, it is also a compound product of Ayurveda. Jatyadi tel, which chameli ke phool se banta hai, and aloe vera gel. So these are the important medicinal plants described in Ayurveda for skin care. This is also called the Ayurvedic cosmetics, Ayurvedic cosmetology, rasayan of skin care. Internal use, amla juice, powder and chamanprash. External use, amla paste or infusion for washing the skin. Turmeric milk, capsule or haridra khand is also preparation made from turmeric. Face pack with turmeric and honey or yogurt is also very commonly used. Manjistha, decoction, capsules and churn is used in ghee. Manjistha paste or oil for massage. Juice of guluchi tablet are used, not typically used externally. Guluchi is always used internally. Estimadu is used internally with milk, ghee and capsule or as a face pack. Neem oil, broth, water, infusion and neem capsules and decoctions are used. Satauri, capsules and churna with milk and mixed with aloe vera gel for topical hydration. Ashwagandha powder with milk, very commonly used as a immunomodulant and not commonly used for the skin outside. Triphala, powder or tablet, daily. Triphala quath for skin wash. This is not taken orally, but only for facial oil. This is not taken orally, internally. This is only applied on the wound, ulcer and skin tension. Jatyadi tel. Aloe vera juice can be taken and gel of extract applied topically. So these are the internal and external of some of them, and only external for some of them. There are three type of classifications have been made. And what are they do? Mainly antioxidant, anti-aging, brightness and complexion. Anti-inflammatory, reduces the essence, clear the complexion. Blood purifier, clears the pigmentation and anti-allergy. So every drug has a specific therapeutic response which has been described here. You see, for example, the Triphala is used as a mild purgative also in Ayurveda. It detoxifies the skin, reduces dullness and prevents aging. Triphala is a rasayan, best rasayan. Harar, Behera, Aula in the mixture is the best rasayan. Kukumadi Tailam is a Ayurvedic, it increases the brightness of the skin, reduces scar and improves texture. And Jatyadi tel is a heal the wound, burns and chronic skin ulcer. This is the wound healing ointment. Like the silver sulfadiazine, we are using allopathy, we are using Ayurveda, Jatyadi tel or Jatyadi grit. And aloe vera juice is for hydrating, healing, reduces the sunburn and for inflammation. So this is a very important thing you must know. Herb in the pre-bed sore skin care. I told you in the beginning, when there is a wound area, that is called the bed sore, and nearby the skin is called the pre-bed sore skin. That is also has to be managed. The role in the pre-bed sore and the wound care, how to use internally as decoction or capsule and externally as the paste or infusion oil. So manjistha, neem, turmeric, licorice and Jatyadi tel, aloe vera, Triphala and Bala is also a new drug which have been added. These are the drugs which are very important in the pre-bed sore skin care. Now, the integrative approach in wound management is very important. Combination of modern medicine plus complementary therapies like virechan, use of herbal rasayana with nutrition. These things can help in better wound healing management. Addresses the physical, emotional, nutritional need, supports overall healing and well-being. Not only this, integrative approach also reduces the financial burden on the family, because the chronic wound healing is a very challenging problem in the modern medicine, and this kind of integrative approach can reduce the financial burden also of the patient. So herbal aids like honey, aloe vera and minor wound, aromatherapy, stress relief, potential healing benefits, and gentle massage improves the circulation if safe. If already bed sore has taken place, massage may not be possible, but other part of the body can be massaged, so the blood circulation will of the whole skin will be improved. Mindfulness and relaxation support the immune system. Last, family and caregiver education is very important in skin care because they are the people who are always with the patients. They should be educated how they should treat the patient to remove the pressure point regular basis on every day. Recognize early sign, as I've shown you in the table, early sign of the pressure sore and infection. Teach cleaning and dressing the technique and emphasize on nutrition, hydration and gentle movement. These are the three things which a caregiver family should be properly educated and they should be advised to take care of patient on these issues. So, holistic patient care in palliative care respect culture, belief and use of the natural remedies. Encourage emotional healing, prayer, art and music. Promote comfort, dignity and low anxiety. And team-based care, physician, nurse, caregiver and dietitian. All the four people should be involved in this care. So take home message is prevention is better than cure. Take away, holistic care includes skin, nutrition and device care. Family education is essential. Compassionate care improves quality of life. With this word, I end this class. Thank you very much.